Are you a newly qualified pharmacist preparing for your first locum shift? Or are you a hospital pharmacist like myself preparing for your first ever locum shift in community pharmacy? In this video, I will be sharing you my experience of how I managed to prepare for my first ever locum pharmacist shift. So if you have watched my previous video before, my background is I am a hospital pharmacist, transitioned to work in an outpatient pharmacy. Again, it's in between hospital and community. So since 4 years ago when I first qualified, I've never had the opportunity to work in a community pharmacy. You're probably aware that there's so much changes happened ever since the pandemic, or even just in the last 6 months. So what did I do to prepare for the shift to ensure that I provide a safe, effective service? Hi guys, if you're new to my channel, my name's Lynn. I am an overseas student from Vietnam who had the privilege to live and work in the UK for the last 11 years. I'm using this channel to share with you guys all of the learning and experience that I have through my time of living and working in the UK. I'm now working as a qualified pharmacist. In this year, I've taken a gap year to work on myself, to have more time to visit my family, to learn about many things that's not just pharmacy, and I'm taking the opportunity to work as a self-employed pharmacist, and that equivalent with working as a locum pharmacist. And in this video today, I'm going to share with you my first ever shift as a locum pharmacist. I hope you find this useful. Again, this experience is unique to me, but again, I hope that it would help you in terms of preparation for your first locum shift much more smoothly. So I did my research. I knew that there's a lot of mandatory training that you need to provide to prepare for the shift, and some enhanced essential services that the community pharmacists had to provide, and you have to ensure that you complete that training. These trainings are available on CPPE website. There is a section regarding community pharmacy so that you can enroll and do it in your own spare time. Complete the e-learning and e-assessment. Those are the knowledge preparation that you need to do to ensure that you are competent to work in a community pharmacy. So how did I feel before the shift? I was really nervous. It's like that feeling going into a completely different environment, and again, because I've not worked in the community pharmacy before, I was very nervous, and so I want to prepare for it as much as I could. So the week before the shift, I tried to contact the pharmacy to see if I can speak to the store manager, but I literally tried for 3 days in a row. I must have called them about 10 times a day to see if I can speak to someone in person, but the phone was constantly ringing and ringing and ringing, and no one was picking up the phone. So I thought, what should I do to prepare myself for the shift? I wanted to be able to book for one company but work in different stores, so that if I want to learn about the procedure, the dispensing system or the SOP, I can just batch doing them and read through the SOP once, sign it all off, and I will be okay. I'll be competent to work across different stores for the same company. So that was my logic. So I booked about 5 shifts for the same company, and I only managed to get hold of 4 of them. On my day off, I booked to visit as many stores as I could and learn what's different services that they provide in that store. It's just the only store for my first ever locum shift that was the busiest store that I could not get hold of them at all. But at that point, because I've been to other stores of the same company, I kind of know what services that they will be providing. And the good thing about pharmacy is that it doesn't matter which store you are coming in, they are operating kind of similar. Apart from you'll be working with different team dynamic, overall the basic role and responsibility as a locum pharmacy, I guess it's kind of similar. Or maybe psychologically, I was much more at ease because I know that I've been to a variety of stores for the same company. So because I could not get hold of them on the phone, I decided to take a risk and book to go there in person, to introduce myself in person. And the store was busy as I thought. The phone was constantly ringing. They was offering the flu vaccination service walking in, and they didn't have their regular pharmacist in, so it was a bit chaotic, I would say, on that day. But at least I get to see it prior to my shift. And in that pharmacy, they have the high street pharmacy downstairs, where you're providing all of the normal community pharmacy services. but they also have an upstairs when they provide care home services. They are responsible to a lot of care home in their surrounding area, so they are really busy. But actually, because I have the opportunity to spend a few hours in that same store prior to my first shift, I was much more at ease. I know what to expect prior to the day that I come, so I wasn't as nervous as I would have been. I should have not come to the store myself in person, and I also have the opportunity to introduce myself to all the store manager, to all the team member that I will be working with. And I guess that they was really appreciated that there's actually somebody commented that they have never seen a locum pharmacist so interested in finding out what they will be working on the same day and so enthusiastic. So I thought it's that first good impressions that I managed to leave to everyone inside them, and they actually really welcoming when I came for my first shift. I think that is such a critical step, that if you manage to speak to them over the phone, introduce yourself during the bit handover, or if you manage to visit the store in person, introduce yourself. I think that's a bonus tip to build that relationship with the people that you will be working with, especially as a locum pharmacist. That is my reflection over my preparation of the first locum shift. So as I mentioned before, the store was very busy. In order to operate, they have 3 pharmacists in the same store. 2 pharmacists will be working in the care home sector, and 1 pharmacist will be working downstairs to operating as a responsible pharmacist. The locum pharmacist, on that day, I was sent to go upstairs to check care homes. From 9 to half 11, I was giving a big tray, like a stack of tray of prescription to carry out clinical checking. The group of patients that I was facing with was again elderly patient or patient with condition like epilepsy or Parkinson that need the care home support. Majority of prescription are the patients that taking multiple medication, at least 7 to 8 medicine. The majority of them are on liquid medication or on high dose of anti-epilepsy or Parkinson medications. To compare with the outpatient pharmacy experience that I had so far, patient would likely to attend the hospital pharmacy to initiate on a treatment, so the dose that I was seeing is much lower compared to this group of patients in the care home, because I guess they had been titrating and reaching a higher dose. So the things that I've seen is, like, for example, I was seeing prescription for baclofen. So the initial prescription that I was seeing, community outpatient pharmacy will be at 10 milligrams 3 times a day, and with this one I was seeing baclofen prescription as the maximum dose of 100 milligrams daily. Those are the kind of scenario that I'm not familiar with. Those spend a bit of time to look into them, checking on the news guidelines or checking through the patient's BMR to see if they had it in the past, how long have they had them, is it an intentional dose increase. The rest of the time, so from half 11 to 1 o'clock is when I was just focusing on ACT. They are so busy with many care home prescriptions. They had about 5 different staff that's just dispensing, and RO, myself, and the other relief pharmacist was checking through all of that prescriptions. The other things that I find helpful is that wherever you go, regardless of what environment that you will be working with, you should always have established checklists of what you are going to cover when you are screening through the prescription. So what checklist did I have for myself to provide the clinical check or for the prescription? For clinical check, step number 1, I'll be screen through the prescription to ensure that they are legally completed. The second checks that I carry is that going through all of them to make sure that you are screening for the same patient, that there's no other patient's prescription getting stuck in between stack of prescription that you are screening to. Then I look through the whole prescription and I lay them out to ensure that I've screened through them all. There's no possible interaction with different medication. I check the prescription as the whole. Then I go through every individual dose of different medication to ensure that they are. The 4th step that I'll be going through is that to ensure I comparing the list of medication on the prescription, the doses, and how they are different with the mark chart that's been printed out to ensure that they are updated. The mark chart that I'm checking is updated to with whatever dose that the patient have this time, because some pharmacy might have like an automated generated mark chart that they had certain dose of medication might have been recently updated, so I need to make sure that that they are correctly matched. So what were the overall feeling for the day? Would I go back to that pharmacy again? The answer is yes. The shift was not as difficult as I thought it would be. It went really fast because I was constantly bombarded with things to do. Definitely didn't have to clock checking at all, and I made £400 a day. It's just saying that the power that if you actually willing to be flexible and venture out of the comfort zone, and again with the cost of living are increasing so much, or if you are saving up for your deposit for the first house. So these are the steps that you can actually do if you are a qualified pharmacist. You want to fast track your financial freedom like I do, then this is something that you should consider. Because it's actually good fun to actually venture out, meet new people, knowing about different systems, and earn an extra money in your pocket. Did I learn anything new? Yes, when I did my clinical checking, I managed to encounter a variety of different prescriptions that I've not come across before. Again, it was an opportunity for me to learn and actually go home and reflect over it as part of my CPD to learn about managing medication in a care home. So as an overall experience, I love my first ever locum shift. It's given me really excited. That's something that I can actually do within this year and would allow me to earn much more money in a short period of time, to allow myself to have the headspace to try a variety of other things that I want to explore in my gap year. I really enjoy the shift because it gave me the opportunity to meet more people. It fits my personality to be able to travel to different places and get to put myself in the uncomfortable situation to learn something else so much more and getting out of my comfort zone, which is something that I want to work toward. So I hope you find the learning that I have from my first locum shift useful. I hope that you managed to get some useful tips in this video to help you prepare for your first ever locum shift. Thank you very much for listening, and I look forward to see you again in the next video. Take care and goodbye.